The knee is the biggest joint of the body and is capable of taking enormous amount of load, but people often ignore its importance until pain strikes.
Whether or not you're having knee pain while walking, running, playing sports games, or climbing stairs, today's video is for you. Hi, I'm Chloe.
And I'm Li Feng. We are physiotherapists from Balance Core. Conventionally, treatment for knee has always been focusing on knee joint itself, but in fact most of knee pain is not a standalone condition.
In today's video, we'll be sharing with you how we can help with your knee pain by addressing the root problems. Like any other joints of the human body, the knee tends to get painful when there's an abnormal load onto it. If the knee is in an ideal alignment, the force going through the knee will not cause pain or injury. Being the center joint of the leg, abnormal force from the hip or the ankle will always have an impact on the knee joint. The knee tends to get injured or degenerated over time when there's a combination of forces in multiple directions. This is compression plus gliding force or compression plus twisting force.
The single leg balance is one of the good ways to look at the forces going into the knee. Let's use the foot model here. Let's have you stand on one of your legs, and where do you feel the most pressure under the foot? Is it more towards the forefoot, which is the front part of the foot, or the midfoot, which is the arch area, or the heel? Let's have Chloe here. If you feel that most of your weight is under the forefoot, then most likely the hip joint or your hip joint is swayed towards the front. And then your knee would be most likely being pushed backwards in order to counter that forward force. And this generates a compressive force plus a gliding force. If you feel that most of your weight is under the inside part of your foot, which is the arch area, then most likely your knee would be turning inwards and the foot arch tends to flatten. That tends to create a force that's in compressive and twisting manner, which lead to overloading of the structures around the knee, including ligaments, cartilage, and tendons.
Ideally, the outer part of the foot and the heel should bear majority of your body weight. And for that to happen, the hip and the ankle joint must be in the right alignment. Today, I'll be sharing with you some stretching and strengthening exercises that can help you with that. The first exercise that I'll be showing you today is called the Clam exercise. And this exercise aims to help to put the hip in the right alignment. The muscles involved in this exercise are the gluteus medius muscle found on the side of the hip and the gluteus maximus muscle found on the back. These muscles are important pelvic stabilizers and external rotators of the leg. However, this exercise is often done incorrectly as most emphasis is often placed on the opening of the knee instead. And this would use the muscles on the outside of the thigh. An individual doing the exercise correctly should feel the contraction over at the back instead of the side of the thigh. The cue is to squeeze the buttock very gently to allow opening of the groin in the front. And this is very similar to a clam, hence the exercise.
The clamshell exercises helps you put the hip in the right alignment. Now this exercises will help you put the ankle and foot in a better alignment. And the muscle that's involved in this exercise is called tibialis posterior. It runs from the inside of the shin down to the top of the arch. So its function is to lift up the foot arch. Okay, so by doing these exercises, you would be thinking about raising the foot arch away or higher away from the floor, and at the same time making sure that the toes are not gripped. And after that, usually you would find that the inside part of the foot here is a bit further away from the floor too, and you want that to be rotated a bit lower. Okay, so it's basically an arch high, soft toes, and a little bit of downwards turning of the first toe at the ball of the foot part. Taking note that one of the most common mistakes while performing this exercise is when people try to lift up the foot arch, they tend to claw the toes, which helps kind of raise the arch at the same time. That would be actually using the toe muscles mostly, the muscle that actually grip the toes instead of the muscle that lift the arch. So again, you would be thinking about raising the arch, same time make the toes kind of soft away from the floor while allowing this bit going down towards the floor, not the toes.
To start off the exercise, we'll first have you to gently pull in your abdominals and squeeze your gluteals together to support the pelvic area. And then we'll get you to lower yourself slowly down, not allowing your knees to pass over your toes so that the stress over your knee joint is reduced. As you're lowering yourself down, be sure that you're not gripping yourself too much. And you can do this by checking if you are able to actually shake your leg in a very free manner. To add on, your ankle must be also in the right alignment, and you must ensure that the arch of your foot is maintained and not flattened. The toes of your foot should also be free and not gripping excessively on the floor. Common mistakes that we've seen doing wrongly is that an individual will be gripping excessively on his toes to provide support, as well as turning his knee inwards and also arching his back. When this is done in this position, the correct muscles will not be activated.
There are many ways of stretching hip adductors, and this is the one we use. We will use something like a bed about this height. So get Chloe here to help demonstrate. So get her to stand next to the couch with one of her thighs resting on the couch, same time turning slightly outwards. And the other leg would be standing on the floor, and again with the thigh gently turning away from the edge of the leg, so the two legs are turning away from each other. And to get the stretch, we get Chloe to first walk the hands a bit more forward so that she's rested, and to get the stretch down, she can just sit down towards the floor. And we should feel the stretch on the inside of the thighs. And we can hold that for about 15 to 20 seconds and then recover. The hip adductor stretch helps loosen up the inner part of the thigh. Now this exercise, the second stretch, will be able to help you loosen up the outer part of the thigh. So let's look at the setup. So we have Chloe resting her knee on something soft so that it doesn't hurt the front of the knee, and we get her to rest her foot against a wall or something firm so that you don't have to really hold the thigh. And we'll get her to probably turn the leg in towards the other foot a bit, so that helps tense up a bit more of the outer part of the thigh. And after that, she can think about moving the other foot a little bit more forward, at the same time keep her body relatively straight. Just take note that in this position, try to avoid overarching or getting tall from arching the spine, but rather getting the movement from the movement of the hip here. And to prevent back from overarching, give yourself a gentle tightening of the tummy so that the tailbone tends to tilt down very slightly. From what we have talked about, we can see that the body functions in an interrelated manner. Problem of stiffness at a particular joint may not be a result of that particular joint, but also the joints nearby.
Share with us if you're experiencing any bodily pain and are unable to resolve down in the comments below. As always, if you found such content useful, give us a like, follow and get notified on our Facebook as well as our Instagram and YouTube, and we'll see you in the next episode.